Our next guest is a traditionally trained physician who's been working on the front lines of COVID-19 in both Puerto Rico and New York. Most recently, he was serving as a volunteer MD overseeing emergency services in outdoor tents at Coney Island Hospital in Brooklyn. Dr. Jaime Salas-Rushford joins us now live via Skype to provide insights on what has been successful with flattening this curve and how to prepare our immune systems for this second wave that we're all expecting with COVID-19. Thank you so much for joining us on Colorado's Best, Doctor.
Oh, thank you. Thank you for having me here. I don't know how it's over there, but here it's beautiful, as you can see. It's a perfect day.
It's a really beautiful day here, too, yes. Now, I understand you started the fight against COVID-19 on the front lines in Puerto Rico. Then you went to New York. Thank you, first of all, for just the Herculean effort that you're trying to save so many people. What are the major differences you've seen between Puerto Rico and New York and the patients and hospital care?
Well, New York has been ground zero. It's been very interesting because everything happened here. We tried everything here. We developed protocols here. So Puerto Rico and other states were a bit lagging behind in the wave. So we're fortunate and unfortunate enough to get the first wave and learn from it and make sure we got the best knowledge of what we're doing and try to spread it out through the U.S. and other people to learn about this.
Certainly. Well, what have you been doing specifically to protect yourself and your peers? What are they doing?
Well, obviously, PPEs are very important. Social distancing is also. We've been bumping out our nutrition, our supplements. We're doing vitamin C, zinc, mushroom extract called HCC. We've been using it. I know a lot of people want to go in dive and take every single supplement there is on the shelf. My best advice is to first consult your physician and also go to reputable places like the Vitamin Society, ahcc.net, things like that, and get educated on what you need to take and how often you need to take it.
Okay, you're mentioning this AHCC. Would you back up and tell us what that is specifically and why do you recommend it?
Well, it sort of works like vitamin C, but a stronger sense. Also, it's used in a lot of cancer patients to boost their immune system. Personally, I've been taking it for many years. Obviously, I'm in the front line of many diseases in different hospitals. So for me, it's worked beautifully. That's something I take every day. And also, I've tried to give it to my patients, and I noticed that people who are taking that and getting an exercise and good nutrition have not developed symptoms. That doesn't mean they didn't get the disease, but I haven't seen them getting symptoms from COVID.
That's incredible. That's great information. I'm going to write that down. It seems like something maybe everybody should be taking. Now, before we go, we just have just a few seconds left. What do you think about this next wave? Do you feel it's coming?
It most likely is going to come. It's a matter of now we know so much information and we've gone through so much that it's a matter of learning from our past mistakes and make sure we move forward intelligently and responsibly.
All right. Well, thank you so much for your insights. We appreciate all the incredible work that you have done and all of our frontline workers. Please take care. Continue to stay healthy and safe.